Presiding Officer. Will the Minister make a statement on ambulance services in Blaenau Gwent?
The Welsh Ambulance Service continues to deliver a safe and timely service to the people of Blaenau Gwent. In April this year, 71.2% of emergency responses to Red Cross within Iron Bevan arrived within the 8-minute target, with a median response time of just 5 minutes and 38 seconds.
Thank you very much, Minister. I think all of us recognise the hard work that goes in from paramedics to ensure that people do feel and are safe in their homes. We also know that some calls are delayed, particularly for those of amber and green calls. And we also know that there are some significant issues which prevent the ambulance service operating efficiently. I'm thinking particularly of the handovers in hospitals, and you will have seen some reports about that in the press and the media earlier this week. We also know from the statistics that you yourself have published that something like 21,000 hours was lost in the first quarter of this year in terms of ambulance handovers at hospitals. Now, we know we have very hard-working staff, both in A&E, which feel under enormous pressure because of the pressures on that service, and we also know that ambulance workers are working at capacity as well. So it appears to me that we have a system where we have two groups of people who are working extraordinarily hard to keep us safe and to provide us with the services we need, but the system itself seems to be preventing them from always doing that. Minister, would you undertake to look again, and I know we've discussed this before, but would you look again at the way in which ambulance handovers at A&Es are operated to ensure that ambulances are able to meet, I think it's a 15-minute target, but you've established for them, and able to spend more time providing the service and less time at handovers?
Yes, I'm happy to look in. In fact, there is work already taking place. Yesterday, we had the opportunity to talk about the Amber Review, and in eliminating those really long waits that do take place. Part of that is actually about releasing the capacity that is often held up at a hospital site. And within an Iron Bevan, recently in the last quarter, they had the highest number of delays of over 1 hour. We have two particular measures. One of our ambulances are released within 15 minutes, and the second measure, whether they're released within an hour. So there's real pressure within the current system. Now, in the medium term, we'll have a new facility in the Grange, which should mean that we have a better process and a better system for people to work in. But that does mean that for the next couple of years, before the Grange comes on stream, we do need to make sure that we improve the system that we have. And that is about the whole system. It is about social care. It is about the which we organise different parts. It is also about the practice and procedure within emergency departments as well. And I'm actually meeting a group of clinicians to look at a review of emergency department measures to try and help to change the leadership and the culture within those by listening to their peers as well. This isn't about the government centrally dictating. It is about good practice in different parts of our system, learning from each other and real leadership. And I'll be more than happy to discuss some of the detail with you outside of the chamber as well.